Is meniscus surgery worth it? Hey, this is Dr. P. Got a problem with your knee? Ask Dr. P. I get asked that question all the time. For me, meniscus surgery was worth it, but it's not always worth it for everybody. So watch this video for more answers.
Discover the emotion of victory in motion. Home of knee repair, not knee replacement.
In a case where it's locking or mechanical symptoms, all those things we just talked about, swelling, pain, it's almost always worth it. Now, does it always work 100% of the time? No, but probably at least 85, 95% of the time, it's going to make that person better if it's just an isolated meniscus tear. Now, is it worth repairing a meniscus is a whole different ballgame. The meniscus doesn't have a very good blood supply. That's why it doesn't heal very well in the first place. But once you lose it, then you lose some of your shock absorber and you're more likely to go on to need to get arthritis and need a knee replacement, which we're trying to prevent. So the more we can repair it and get it to heal, the better. The problem is it doesn't like to heal. And even when we put a great surgery together and we sew it together and it looks great, there's still about a 10 or 15% chance it might not heal. Now, we try to increase those odds and improve those odds by using things like PRP, platelet-rich plasma, which is basically growth factors in your own body and helps your body heal itself. Stem cells or bone marrow cells, which has stem cells and other cells that help the stem cells, which can help heal. Laser treatments can increase blood flow. The meniscus doesn't have very good blood flow, so it helps with that. So there's a lot of different things we can do to try to increase the chances of that meniscus healing. Now, if it heals, it's totally worth it because you preserved your shock absorber. If it doesn't heal, you can still go in there and trim out the torn piece. But we have, knock on wood, pretty darn good results using repair and also regenerative medicine techniques, lasers, things like that. But it's not 100%. Now, there are plenty of studies that show that arthroscopic surgery for degenerative meniscus tears or degenerative arthritis is no better than either putting saline in there, just washing the knee out with saline, or cortisone injections or PRP injections or any of those things. It doesn't help the long-term problem because it's a degenerative process. So just going in there and smoothing it over or whatever, or quote cleaning it up, that really doesn't give long-term relief because you're not taking care of the root cause of the problem. So there's a lot of studies that show that arthroscopic surgery for a degenerative meniscus tear, which is just wear and tear and is not causing any locking or mechanical symptoms, really doesn't have a long-term benefit. And frankly, that is why insurance companies a lot of times will not pay for surgery, arthroscopic surgery on a quote degenerative meniscus tear. So we always like to see if the patient's having locking or catching or mechanical symptoms or definite tenderness right on that joint line where the meniscus is, or what we call positive McMurray test, where we twist and turn the knee and they have pain specific to that meniscus, not just diffuse generalized pain in the knee. So there's a lot of things we check to make sure we think the surgery will help. But frankly, there's a lot of meniscus tears that don't need surgery.